Thank you very much.
So it's all yours.
Yeah, thanks, Gary. Thanks, Cheryl. It's a pleasure to see everyone today. Thank you very much for this opportunity to speak today at A&V. I'm going to just share my screen here so that we can start to see the presentation. Get this set up here. Okay. All right. Can everyone see that? It's all good?
Yep.
Okay, very good. So, so today we're going to be speaking about acupuncture and its ability to heal, transform, and empower. I'm Damon Iacovelli. As Cheryl said, I'm an acupuncturist and herbalist at Oliva Acupuncture, and we're located in Falls Church, right between Bailey's Crossroads and Seven Corners. So before I get into more about myself, I thought it'd be, a little bit more exciting and fruitful to talk about what other people, medical science, is saying about acupuncture right now. Let's see if I can get that thing. Here we go. So from Dr. Richard Nayan he's the principal investigator at the National Institute of Health on acupuncture. He said, in many studies on pain management, it's clear that if you're comparing acupuncture to usual care, the acupuncture group almost always does better. And from Dr. Arnice Pock, the associate dean at the U.S. Uniformed Services University of Health Sciences, basically the medical school for the U.S. military, he says that acupuncture can treat almost any type of acute or chronic pain. It works very quickly. A Danish study showed that acupuncture proved effective to treat many of the symptoms of perimenopause: hot flashes, night sweats, insomnia, anxiety, and depression. That's from the British Medical Journal. The most effective fertility treatments involve a combination of acupuncture, herbal medicine, and traditional medicine. That's from the American Pregnancy Association. Researchers studied the effects of acupuncture on psychological distress and other symptoms in breast cancer survivors. They found that compared to standard care, acupuncture greatly improved anxiety, depression, and fatigue. That's from the Memorial Sloan Kettering Cancer Center. Research published in January of 2024 showed that acupuncture to treat stroke survivors could improve aphasia, a speech and comprehension issue. Acupuncture can be a key part of the rehabilitation process for stroke. That's out of the Journal of the American Medical Association. So I just wanted to, show not just what my opinion is about acupuncture, but what medical science is also thinking. So let's talk a little bit more about me and how I came to get into acupuncture and Chinese medicine. So originally I came to acupuncture and Chinese medicine through the study of traditional Chinese martial arts, or Kung Fu. Oops, sorry about that. In my system, not only do we study martial arts, but also meditation and therapeutic and herbal medicine. In 1996, while training for an international tournament, I was badly injured, tearing a tendon deep in my pelvis. I could barely walk, let alone practice Kung Fu. My coaches referred me to a Chinese doctor in Alexandria who had been an acupuncturist for the Chinese Olympic team. His name was Dr. Chen. He quickly assessed my condition, reassured me that he had treated my exact injury hundreds of times. Sorry, I'm having some technical problems here. My mouse is not showing up. And told me that he'd be able to get me back to competing in 6 weeks. So I diligently went in for treatment twice a week, but I had no idea what the doctor was doing, but I trusted in the process. But after 6 weeks or so, I was back in fighting shape and went on to the tournament and was able to win 6 gold medals. I'm sorry, 3 gold medals. And I was just totally blown away by that whole experience. And I totally changed paths and decided to dedicate myself to Chinese medicine and started interning with Dr. Chen. I spent 3 years in her clinic and I just tried to learn all of everything that he had to offer me. Okay, here we go. Luckily, after about 3 years of studying with him, I decided I needed to become formally trained so I could get licensed to practice. Luckily, there was a school in Bethesda, the Traditional Institute of Traditional Chinese Medicine. There, the faculty were Chinese nationals with PhDs in both Chinese medicine and Western medical science, like physiology and microbiology. Many of them were running research studies at NIH investigating the science of how acupuncture worked on a biological level. I spent the next 3 years there learning the medical science of acupuncture, not only what worked to heal patients, but also the mechanisms behind why it worked. Beyond my 3 years of medical acupuncture, I returned to school at the Oregon College of Oriental Medicine to obtain my master's degree in advanced acupuncture and herbal medicine. The focus of my work there was using acupuncture and herbal medicine to treat metabolic disorders such as type 2 diabetes. Over the years, I've been lucky enough to be invited to work in many of my Chinese teachers' clinics. Here in Alexandria, I practiced sports medicine and orthopedics for 4 years with a doctor that first opened my eyes to acupuncture. In Oregon, I worked with my principal advisor, a women's health specialist from China. Also in Oregon, I worked in an outpatient cancer treatment center for Providence Hospital System. Now returning to Northern Virginia in 2022, I run Oliva Acupuncture with my wife and partner, Kate, in Falls Church, Virginia. At Oliva Acupuncture, we specialize in women's health, fertility, pain management, and mental health, helping dozens of patients every week heal without the need for drugs or surgery. So
Damon,
enough
can you
about me.
explain what the letters after your name stand for?
Sure. So MACOM stands for the Master. It's a Master of Acupuncture in Oriental Medicine. It's an outdated term now, but unfortunately, when schools began granting degrees back in the mid 70s, that was the term. Now, I think saying Chinese medicine or East Asian medicine is a little bit more current and maybe politically correct, but that is the name of the degree. And then LAC means licensed acupuncturist. So I am licensed both in the state of Virginia and the state of Maryland, or the Commonwealth of Virginia, and am licensed by the Board of Medicine, the same people that licensed medical doctors and physician's assistants. And then I'm also an LMT in the state of Virginia. It's necessary for us if we do massage or body work to be licensed by them, and I'm directly licensed by the Board of Nursing there. So that's what all that alphabet soup after my name means.
Thank you.
Yeah. So let's talk a little bit more about what acupuncture actually is. So it's a complete medical system. It's over 3,000 years old. It's used to prevent, diagnose, and treat many forms of disease. In acupuncture, health is the proper balance of vital energy and blood. This vital energy is called qi. When the qi and blood are out of balance in the body, disease results. Acupuncture is simply the insertion of very thin needles into specific points in the body to restore balance and health. In addition to needles, most acupuncturists also use other traditional Chinese medicine therapies such as herbal medicine, massage, cupping, nutrition, and exercise to heal their patients. So a little bit about the history of acupuncture. It's a very old, long, complicated, and honestly, it's a bit boring unless you're a real nerd like me. But basically, it all started with Taoist hermit monks 3,000 years ago. These monks lived high in the mountains and spent all of their time observing nature and meditating, the practice of observing themselves. Their aim was to live long and to be very old. This was necessary to become spiritually enlightened. Obviously, being healthy was one of their primary concerns. They began to notice that they were their healthiest when they were living in harmony with the natural world. Through their meditation practice, they saw that the microcosm, what's inside the human body, was a reflection of the macrocosm, the universe all around them. From these realizations of the ancient monks, we find the essential principles of acupuncture and Chinese medicine. Jumping ahead almost 1,000 years, I just want to mention two key books that have survived the ravages of time to become the foundation of acupuncture education even in today's colleges. The Yellow Emperor's Internal Medicine Classic, over 2,400 years old, is the oldest book on acupuncture and still contains all of the information that is used every day to practice acupuncture around the world. And then this other book, The Manual on Cold Damage, nearly 2,000 years old, is the foundational work on herbal medicine and was written at a time when a very long epidemic of respiratory disease ravaged China, killing a large portion of the population. These herbal formulas contained in the book have proven themselves over the centuries and were even some of the most effective forms of treatment in China during this latest COVID outbreak. So just to show that even though this medicine is very old, it's still very relevant in today's practice of contemporary medicine. So let's jump
Let's jump
ahead
ahead.
a couple of thousand years to the mid 20th century to understand acupuncture in the modern era. After World War II, China had moved away from imperialism to become a nation state, bound and determined to modernize and industrialize itself for the betterment of its citizens. At the time, the Chinese government was determined to leave the old superstitious ways behind and adopt a plan of action based on scientific rationalism. Acupuncture at the time was seen as an outdated folk-based belief system with no scientific underpinnings. But as a young and poor nation, China was in desperate need for a public health system that was cheap, effective, and already well distributed throughout the country. Acupuncture filled all of those needs. But in keeping with the new belief system and scientific rationalism, the new government took traditional acupuncture and began to modernize it, infusing modern medicine into the ancient practice. Large universities were founded to teach a standardized acupuncture curriculum that was a mixture of traditional technique and modern medical knowledge. With new, highly trained physicians, China was able to build hospitals with both acupuncture and Western medicine departments to best serve this growing population. And that's still true today. This blending of traditional wisdom with medical science led to many advancements in acupuncture as research began to demonstrate its effectiveness in treating many very serious diseases. Then in 1972, when Nixon was on his groundbreaking trip to open China to the West, the next chapter of the history of acupuncture began. A reporter for the New York Times, James Reston, became ill with appendicitis. He needed emergency surgery, and while recovering, he was treated with acupuncture instead of narcotic medications to control his pain. He was amazed at how well it worked and wrote an article describing his experience with a previously unknown form of medicine. Once word got out in the United States about acupuncture, there was a flood of interest from the medical and research community. Later in 1972, the NIH began funding the first Western studies of acupuncture, and informal instruction for medical doctors began in Los Angeles. By 1975, the New England School of Acupuncture, the first school of acupuncture in the West, opened in Boston. And then by 1998, the NIH created a standalone National Center for Complementary and Alternative Medicine with research into acupuncture as one of its main focuses. Today, acupuncture has more or less become an accepted form of medicine around the world. In the United States, many of the country's most prestigious university and hospital centers, such as Harvard, Columbia, and Johns Hopkins, as well as top specialty clinics like the Mayo Clinic, Cleveland Clinic, and Sloan Kettering, have all integrated acupuncture into their programs, offering acupuncture alongside other forms of traditional medicine. Now, the theory in getting into the traditional acupuncture and some of its theories. So, traditional acupuncture uses ancient theories to understand the body and the diseases we suffer from. These theories, including yin and yang, the five elements, the Zongfu internal organ systems, and the categories of pathological factors, are fascinating, but often confuse my patients in the clinic. While they're important for me to understand to properly diagnose and treat your condition, to most patients, this information is just not relevant. The same is true for the theories of pharmacology or microbiology and conventional medicine. You don't need to understand them to take a pill and to have it work in your body. But I do want to spend a minute to talk about acupoints in the meridian system, the place where theory meets practice in the clinic. So acupoints are specific locations on the body where qi and blood accumulate. Modern research has shown that they're often associated with key neuromuscular junctions, blood vessel branches, lymph nodes, or vital organs. The acupuncture points are organized along vertically running meridians and are associated with specific organ and elemental energy. Points along a meridian typically have more effect on the corresponding organ and energy system. Acupoints have a specific action associated with them and are assembled into a treatment protocol, much like a prescription. By using a wide variety of acupoints, it's possible to affect the symptoms a patient experiences. That's why we insert needles both locally at the site of pain, but also distally along the meridians far from the site of pain. When inserted, acupuncturists aim the needle into the exact precise location, which will open that point and allow qi and blood to flow in the meridian, restoring balance. Now, a little bit more about the history of modern acupuncture. So China attempted to modernize in the middle of the 20th century, forever changing the understanding and practice of acupuncture. By applying the scientific method and contemporary research techniques, the Chinese were able to find new methods of acupuncture that produce results beyond what ancient acupuncture could achieve. Electroacupuncture applies microcurrent to the needles to stimulate the central nervous system. This produces greater effect than normal acupuncture to inhibit the pain centers deep in the brain. It produces large amounts of endorphins to reduce pain. In addition, low-frequency pulses help to strengthen weakened and atrophied muscles, helping people recover from things such as stroke, while high frequency helps to relieve chronic muscle spasms, often associated with things like chronic back pain. Scalp acupuncture came out of research from the 1950s. By placing needles in locations in the scalp that are known to correspond to specific areas of the brain, it's possible to improve conditions such as limb paralysis, speech dysfunction, balance, tremor, and vision problems in patients with neurological diseases, such as stroke, multiple sclerosis, traumatic brain injury, cerebral palsy, and many others. Although auricular or ear acupuncture has existed in China for thousands of years, a renewed interest in the simple to administer treatment grew in France in the 1950s. By placing just a few needles in the ear, it can be possible to produce a wide range of positive effects throughout the body. Since the treatment only needs access to the ear, it's very suitable to treatment in large groups of patients simultaneously. The National Acupuncture Detoxification Association has adopted a simple 5 needle protocol used to help people get over drug addiction. And this is the most serious forms of drug addiction, like heroin, crack cocaine, methamphetamines. It's all been proven to be very effective in helping people recover. And then the US military has also adopted a 5 needle protocol called battlefield acupuncture that is used to manage a soldier's pain and battlefield trauma. So a word about acupuncture and how it's been integrated into conventional medicine. Since the medical community first became aware of acupuncture in the early 1970s, acceptance of it as an effective and worthwhile treatment has grown. Now, some 50 years later, acupuncture is quite commonplace and is often offered side by side with more conventional treatments like drugs and surgery for conditions as varied as lower back pain, PTSD, stroke, and cancer. Here's a list of just a few of the most prestigious medical institutions in the country that offer acupuncture services. And I put up a listing of some here in our area: Johns Hopkins, George Washington, um, as well as Georgetown University, all use acupuncture and offer acupuncture services as part of their treatment plan. And then acupuncture has also been validated by medical research. More and more scientific research is demonstrating that acupuncture is as effective as conventional medicine for treating a wide variety of conditions. In the past 20 years, research into acupuncture has increased at a tremendous rate. With every new study comes the possibility of finding more conditions favorably benefited by acupuncture treatment. And you can see here by the charts in the last, 10 years or so, you can see just how much in the United States research has grown, and this is also true around the world. Now there's some 95 countries worldwide that regularly conduct research into acupuncture. So now talking less about the theory and the history, let's talk about how acupuncture actually works. So one of the ways is it's been found to release endorphins. Endorphins are hormones that are released in the center of the brain. They bind with opioid receptors to relieve pain, reduce stress, and improve mood. They also play a key role to regulate the immune and inflammatory response. They also have been shown to decrease inflammation. There are two types of inflammation: acute and chronic. Acute inflammation is good. It's the body's immune response to injury or infection to kill invaders and to heal damaged tissue. Chronic inflammation, on the other hand, is bad. It lasts for months or years, often in response to poor lifestyle habits like bad diet, smoking, excess alcohol, and lack of exercise. The immune system is constantly attacking the body's own tissue, leading to pain, fatigue, weight gain, and depression. Long-term, chronic inflammation leads to diseases such as type 2 diabetes, cardiovascular disease, and cancer. It also has an effect in regulating growth factor. Research has shown that electroacupuncture increases growth factors necessary for the repair of nerve tissue. This can be very helpful in the treatment of diabetic and chemotherapy-induced peripheral neuropathies, hemiplegic stroke, where people lose the ability to move one side of their body, and other neurological diseases. And then the last is it's been shown to release adenosine. Adenosine is a molecule distributed throughout the body with a wide range of effects. Studies have shown that acupuncture stimulates the release of adenosine in local tissues, and it binds to the nerve cells to inhibit pain signaling. Also, adenosine is the key component of adenosine triphosphate, or ATP. Now, if we can just go back a few years and dust off your memory of high school biology, you may remember that ATP is the energy molecule responsible for cellular metabolism, if you remember the Krebs cycle and having to try to memorize that for your tests. So the more adenosine that there is in the body, the more ATP there is, meaning an overall increase in cellular metabolism, which helps to improve conditions like diabetes, high blood pressure, and high cholesterol. Here's a list of conditions that are known to actually benefit from from acupuncture and have been verified by the National Center for the Complementary and Alternative Medicine Program at NIH. They have found clear evidence of the effectiveness of acupuncture as a treatment. So we have many different pain conditions: back pain, osteoarthritis, headache, migraine. But interestingly, there's other conditions that have been noted, such as like irritable bowel syndrome, seasonal allergies, urinary incontinence, chemotherapy-induced nausea and vomiting, depression, infertility, and then hot flashes associated with menopause. Acupuncture has a wide range of applications and it can be very effective for many conditions that we all suffer from. And then as a side note, I've used acupuncture and herbal medicine to treat every one of these conditions to varying levels of success in thousands of patients.
We have a question here. How about foot pain, specifically on the bottom of the foot?
Yeah, so are we talking like a condition like plantar fasciitis? Or are we talking something more neurological like diabetic peripheral neuropathy?
I don't know. That was all the question had. So
Okay.
if this person wants to weigh in with more details, I can pass those along.
Well, if it's
But
something like, go ahead.
I was going to say, but otherwise, why don't you go ahead?
Yeah,
Oh,
so
sh
it,
she's just saying overall pain.
yeah,
So
overall pain. So if it's not a diagnosed condition, like if you don't have diabetes, then more than likely it's a condition called plantar fasciitis, which is basically tendonitis in the sole of the foot. And so acupuncture is actually very effective for that. And we use it in combination with also with exercise, as I was mentioning earlier. So we do needling, not so much into the sole of the foot, that can be quite painful, but around the ankle, and then also up into the calf. Oftentimes I find that pain in the feet is associated with chronic muscle tension in the calves. And by not having full flexibility in the ankle, it stresses the foot more. So we try to relax the muscles in the calf. We do lots of massage also into the calf, and then we have a set of very specific exercises that we prescribe for the patient. Usually it's a condition that takes a bit of time to resolve. It's not instantaneous, but within, probably 12 treatments or so, we can make significant benefit. All right.
okay.
So now getting more into the practical aspects of, giving you information about acupuncture. And so um, when a patient calls, one of the first questions I always get is, will insurance pay for my acupuncture treatment? And the good news is that most healthcare insurance offers coverage for acupuncture treatments, either plans through employers or purchased off the marketplace. And then also supplemental plans through Medicare will often pay for acupuncture as well. Um, Though some of you might be aware that in 2022, Medicare began to offer coverage directly through Medicare reimbursement for chronic lower back pain. But as of right now, only MDs are qualified to provide that acupuncture service. Acupuncturists themselves have not been added to the roles of qualified physicians. So that's something that our national association is working on. There's legislation before Congress right now, and hopefully this year that will change so that we can begin to offer direct services to Medicare patients. But right now, through supplemental plans, most of the time people will get coverage. Um, Most often, people will have between 12 to 50 self-referred, which means no doctor's note is necessary, coverage for treatment. They're often just simple co-pays or co-insurance payments. But most coverage is limited to treating some form of pain, nausea or vomiting, or anesthesia, often with dental procedures as the primary complaint. But it's possible for us to also treat secondary complaints as well, things like hot flashes or depression or other kinds of digestive complaints, as long as you have a primary pain complaint. Insurance will pay for that with no issue. So So let's talk a little bit about what to actually expect during treatment. So when you come in to see an acupuncturist, usually the first time you come in, it will be an expanded session, usually about 90 minutes in time. And there we'll do a full medical intake. We want to know absolutely everything that's going on with your health, your current complaint, and your health history. Oftentimes, if it's a pain complaint, we'll do a physical exam or do some kind of orthopedic testing so we can understand whether your pain might be caused by compression of the nerves in the lower back, or maybe it's more an arthritic condition. Oftentimes too, we see problems with people's muscles or tendons. So it's important for us to understand exactly the location of the pain and the cause. And then from a Chinese medicine perspective, we'll also do a pulse and tongue diagnosis, a pulse and tongue exam, where we'll read pulses on both wrists and gives us an idea of what's going on internally in your body. And from your pulse, we can determine whether your condition might be related more to heat or maybe something like blood deficiency or qi stagnation, something like that. And then we look at your tongue and we look for things like the color of the tongue, what the coating on the tongue looks like, and we look at the veins underneath the tongue to see if there's any blood stasis, if the veins are very large and purple. And then we get into treatment. So most of the time, we have patients disrobe if necessary, but oftentimes if they're wearing loose-fitting clothes, they can just roll their pants up above their knees, lift their shirt so we can get access to their abdomen, and we'll insert the needles. And then in the setting, it's a private room, and the lights are dim. We have heated tables. We put heating lamps on people, and we play relaxing music. And we let people just relax for about 45 minutes. And then at the end, if it's a pain condition, we often come back and we'll do direct massage onto the area of pain with some cupping and some more heat therapy. Aftercare is relatively straightforward for acupuncture. Oftentimes people might nap during treatment, and so when treatment is over, they might just take a few minutes to need to sort of wake up and recover in the waiting room. But basically, acupuncture has no specific, long-term aftercare. We often just recommend people rest for a few minutes, make sure that they're stable and that they can drive their cars, drink a little bit of water, maybe have a snack when they get home or something like that. But otherwise, they're fully able to get back to their normal day. People often come in during their lunch hours, get acupuncture treatment, and then go right back to work. And then most acupuncturists should also discuss with the patient after the first visit a treatment plan, and we'll give them an idea of what we think their condition is, and then how many treatments and the exact therapeutic methods and everything we want to use. Most pain conditions can be resolved or at least make significant benefit in the body with probably 8 to 12 treatments. Something that's been very long and chronic, or if it's a complicated condition, might take longer. I've had some people come in, they pulled a muscle in their back gardening, and we were able to take care of their problem in just 2 treatments. So it really just kind of depends on what your issue is and how quickly it can be resolved. And then a lot of people ask, like, what does acupuncture feel like? A lot of people have either fears of needles or just in general, I don't think anybody really jumps for joy when they think about getting needles stuck in them. So that's one of my most common questions is, does it hurt? And my answer to that is acupuncture is not really painful, but it's not without sensation either. I often tell patients that I envision acupoints as a three-dimensional sphere located just under the skin. And to get the best effect, I have to place the tip of the needle in the center of that sphere like a key in a lock. When that point opens, the meridian opens, allowing qi and blood to move again, restoring balance. The opening of this point is often accompanied by sensations. Some people feel a movement of energy, a tingling, or a heaviness. Very rarely is it ever painful for people, though. And the vast majority of my patients, about 95%, find acupuncture to be very relaxing and will often nap during treatment. Some find it to be the most restful sleep they get all week. And then about 75% of my patients get immediate benefit, even if it's just small. I always ask them to rate how they feel once they get off the table, and the vast majority always feel better. And the thing to keep in mind that acupuncture, like all forms of medicine, is dose dependent. The amount of recovery, the speed of recovery, and how long the recovery lasts depends on the frequency and duration of treatment. More acute, short duration, simple conditions like a muscle sprain that I was talking about earlier often resolve very quickly. But chronic, complicated conditions like lower back disc degeneration with bone spurs and nerve root compression will take much longer to fully resolve. If your acupuncturist is experienced, trust them to develop an appropriate treatment plan best suited to your condition. So I want to just talk real quick about Aleva acupuncture and our philosophy. So we talk about healing, transforming, and empowering. So by healing, we mean acupuncture is a safe, natural, and effective treatment for a wide variety of conditions. Transforming is I've personally seen acupuncture transform people's lives, either by managing debilitating pain so they can get back to their activities that they love, or restoring the use of a limb so that they can simply walk again after having a stroke. And then it empowers people by overcoming debilitating disease or their ability to finally start a family after years and years of trying. People can get their lives back, their will to live, and the power and courage to face life again. And then we talk about acupuncture for every stage of life, for every generation. In every stage of life, we mean that most of our patients are women, like 80 to 85 to 90%. Women just seem to be more focused on maintaining their health, especially as they age. But they come to us in their 20s with period pain, digestive complaints, migraine headaches. In their 30s and 40s, they come to us with fertility issues, endometriosis or PCOS, and anxiety and depression. In their 50s and 60s, they come to us with hot flashes, night sweats, or now the recent onset of diabetes or high blood pressure. In their 70s and 80s, they come to us with degenerative spine issues, balance issues, and knee pain. But at every stage of life, we use acupuncture to find a way to heal them. And then for every generation, we mean that by the fact is that women are the decision makers in the family regarding healthcare. Once they see that acupuncture is truly effective to fix their problems, they start to bring in all of the generations, their kids, their partners, their parents, maybe even their grandparents. And again, acupuncture is there to help them heal. And then finally, we believe that acupuncture is a team effort. At Aliva, we believe that open communication and teamwork are essential for providing high quality and effective healthcare. Teamwork has been shown to improve patient outcomes and increase patient satisfaction. Our practitioners have a collaborative mindset and work with all of the partners in the therapeutic relationship, the patient, the family, the acupuncturist, and other medical professionals to find the best treatment solution for the condition. And then just a little bit about what we treat specially, our specialties. We treat women's health, and again, that's across the board from young women through childbearing age into menopause, and then later in life. We treat a lot of fertility, pregnancy, and postnatal. Both me and my wife have been quite successful in helping women get pregnant, have a healthy pregnancy, and then successfully deliver children to start their family after many years of trying without success. We work on pain management. That's kind of the backbone of acupuncture. Everyone knows about its ability to help with pain. And then we also treat mental health. Washington, D.C. is obviously a bit of a pressure cooker, more so in the last few weeks than maybe ever before. I think a lot of people are feeling like what's going on. This high level of stress can really wear people down, causes lots of anxiety, depression. But then we have special populations here in the area with with military personnel, people who are suffering from PTSD. Treated lots of military police officers, people involved in federal law enforcement who have these issues. And acupuncture can be very helpful for helping them to restore balance and kind of get back to a normal and healthy outlook on life. So that pretty much concludes my presentation. Let me try to get out of this real quick, and then we can go to any questions that you might have.
One question I have is you listed a lot of things that acupuncture is uh, helpful for treating. Are there any conditions or diseases that it's not appropriate for?
No, there's no condition that it's really contraindicated in. In pregnancy, we use special care. There are points on the body that have a very strong downward moving energy, and we don't use those points during pregnancy. We also don't use certain kinds of therapeutics, like we don't use infrared heat therapy for people who have high blood pressure, it tends to raise blood pressure. But in general, acupuncture is safe for all conditions, sometimes more or less effective, but definitely there's no specific contraindications for any one disease. The only other thing we don't do is we don't needle through broken skin for, we have to be mindful of infection and things like that.
How do you determine how many treatments a person should have? And how often do you receive referrals from physicians?
Mhm. So in determining the number of treatments, it's often a clinical judgment and based on years of experience. So we usually start people with a chronic condition, say like low back pain that they've had for many years, maybe associated with disc degeneration or arthritis. And we'll start people on a treatment plan of maybe 8 to 12 treatments, and then we'll track their progress. And then at the end of that initial treatment plan, we'll do a reassessment, we'll do some testing, and then we'll see if an additional course of treatment is warranted. We tend to start off with treatments that are a little bit more frequent. Sometimes if there's very high levels of pain, we might start with 2 times a week for a couple of weeks and then move into 1 time a week. And once the pain is under control, we might move into more maintenance care where people come in every couple of weeks or once a month. And do we refer referral or do we get referrals from physicians? We do. We get referrals all the time from. I've had dental surgeons refer to me for when they have patients that where surgery isn't quite right, but they have severe dental pain, jaw pain. Mental health professionals, orthopedists, neurosurgeons, those sorts of things, where surgery isn't always the most appropriate form of treatment.
The next question is acupuncture effective for peripheral neuropathy caused by chemotherapy if you've had the pain for a number of years?
Yes, it can be effective, but mo- like most forms of treatment, in most conditions, the longer that the condition has been present in the body, the more difficult it is to reverse. So I've had good success in treating people with chemotherapy-induced neuropathy, um, but everything is a case-by-case basis. The longer it's been in the body, the longer people have been suffering from it, typically the longer treatment is necessary with acupuncture.
Can acupuncture help relieve scar tissue pain?
Yeah, that's one of the things that acupuncture is kind of renowned for is the ability to help relax the buildup of irregular collagen fibers around scar tissue. So we do needling, specific needling techniques around scars, and then we also provide patients with special topical medicines and instructions on how to massage the scar to help break up the congestion in the tissues. So absolutely. We do a lot of work, especially on post-surgical scars, C-sections, knee replacement, hip replacement, those sorts of things.
Okay, what about conditions like having no cartilage left in knee joints that would traditionally call for a knee replacement?
Mhm. So acupuncture is effective at helping people control pain in that situation, but acupuncture is not curative for degenerative osteoarthritic conditions like problems with the knees or the spines. We can't make cartilage grow back in the body. We can't change the bony deformation, the bone spurs, and everything that occur. Usually, what we do is we help people reduce pain and restore function, get back to being able to walk and climb stairs again. But if the degradation to the joint is severe enough, oftentimes, yeah, surgery might be the best course of action. Acupuncture is effective, but it's not medicine. I mean, it's not magic, it's medicine.
Okay, what are next steps if acupuncture doesn't seem to be working?
If acupuncture doesn't seem to be working, we often talk with patients about herbal medicine therapy. So acupuncture has the ability, there's 3 levels of therapy that we offer. So the first is body work, massage, traditional Chinese medical massage. And that tends to work on what we consider to be the exterior of the body, the muscles, the tendons, those sorts of things. So simple aches and pains can be addressed with massage. Acupuncture crosses over between the exterior of the body, some pain conditions, into the interior of the body, digestive complaints, headaches, those sorts of things. And then if there's a serious condition that seems to be much more rooted deep in the body, in the organ systems themselves, then we often recommend herbal medicine in conjunction with acupuncture. Unfortunately, acupuncture is not able to cure every condition, and so I routinely refer patients out to get other kinds of medical evaluations. I'm working with a woman right now. We were working on neck pain that was referring down to the arm. And it was apparent to me that she was actually having an impingement on the nerves and blood vessels called thoracic outlet syndrome. We made some progress, but not sufficient. So she's now consulting with a thoracic surgeon about potential next steps.
And next one, this person has a friend who's got hip pain, but the doctor said he's not due for a replacement. They gave him a steroid shot, which didn't last nearly as long as they said it would.
Yep.
He's asking, should he recommend this person try acupuncture?
Yeah, I think it would be worth a shot. Oftentimes, that kind of hip pain, we have to determine first, is it arthritis or is it more in the tendons? Oftentimes, doctors will label that as hip bursitis or something like that. So pain is always a bit of a mystery in the body. We have to try to determine exactly what's causing it. Is it in the bones and cartilage? Is it more in the muscles and tendons? Acupuncture can control pain, but it's especially well suited to help to relieve the tension in muscles and tendons as well. So it can be good for hip pain.
Have
Um,
you treated
I'd
people?
like to make a comment if I could.
Please.
Sure.
Uh, I'm an acupuncturist, and I think this was a great presentation. But one thing you haven't mentioned is I think acupuncture before surgery, like a hip replacement or a knee replacement, is really helpful. And also, I would love it if you would join the Acupuncture Society of Virginia. My name's Rebecca Reynolds, and I'm here in Arlington. So
Absolutely.
anyway,
Good.
nice to meet you, Damien.
Pleasure to meet you. And yeah, I completely agree about I think trying to look at other more conservative treatments before surgery is very important, and especially since acupuncture is so cost effective, you know.
Yeah, and post surgery as well. So those are my comments.
Absolutely.
Have you treated anybody who's suffering from long COVID?
Yeah, quite a few patients. And so long COVID is a new condition, obviously. It's only been in existence for about 5 years now. And it can affect a variety of the systems in the body. It has a cardiovascular effect, it has a respiratory effect, it often has an effect on people's digestion. I see people who have a serious depression afterwards, and then also muscle pain. Acupuncture can be effective, but oftentimes, as I was talking about earlier, we use herbal medicine in conjunction with that because it is a bit more of an internal medicine problem, and often takes things like herbs, which can have a more internal effect on the body.
Okay, how about treating sciatic nerve pain? She said hip to leg to foot.
Absolutely. Yeah, I mean that's so in 2022, after numerous positive research studies, Medicare finally approved acupuncture. They finally believe that yes, it's medically proven to work for lower back pain, specifically like sciatic pain, the nerve pain that runs down the leg into the foot. It can be very effective for that. I treat that all of the time. That's probably 35 to 40% of the patients I see have lower back pain like that.
Are there any medications that a person can be taking that would be a contraindication for acupuncture?
Probably the only thing for acupuncture itself, the only thing we really want to know about are any medications that are commonly called blood thinners, better known as anticoagulants, such as warfarin or some of the newer medications that are on the market right now. Oftentimes, it's not a real problem, but it's always important for us to understand that. I treat people all of the time who have congestive heart failure and are on these medications with acupuncture, and there's no real bleeding risk, but it's important for us to know. Now, with herbal medications, herbal treatments, that's a very different thing. There can be lots of interactions between herbs and medicine. So that's why in our initial meeting, we do a complete medical intake and understand all medicines that people are on, so we are safe. And our first goal is to do no harm, just like any other doctor.
Hey, just so you know, we're about 10 minutes to 10 or to 11. I don't see additional questions. One just came in, but before we do, somebody related a story that her father was a military historian, wrote about the war in the Pacific, and he talked about one of his interviewees said he'd gotten appendicitis in a POW camp. There was no anesthesia, but the doctor stuck pins in him while he removed his appendix. And his father was amazed. This guy talked about how much it reduced the pain of the operation.
Yeah. Yeah, there's all kinds of anecdotes of acupuncture being used in China as anesthesia during surgeries. I think it's less and less used now that there's more access to modern drugs, but in the 50s and 60s, it was, I think, quite commonly used, yes.
If a patient is very thin, can there be a problem with inserting the needles?
Yeah, so definitely we always use care when inserting acupuncture needles over vital organs such as the lungs or the liver or the heart, those sorts of things. And so if patients are very thin, we use extra care to ensure that nothing happens. Um, it's always a risk to acupuncture, like any other medical procedure. When you're inserting, needles into the body, we have to be careful about what is under the surface tissues. We have to be concerned about nerves and blood vessels and vital organs and those sorts of things. So we just use extra care. If the patient is very, very thin, we might refrain from needling directly over the lungs or something like that, just to be on the safe side. Very, very rarely does I mean, less when I was on Cheryl's podcast, Aging Matters, I actually did research. And I think worldwide in most Western countries, there had only been maybe 3 or 4 instances of lung. It's not even puncturing the lung. It's called pneumothorax. It's just puncturing the space around the lungs. Only 3 or 4 instances in the last 25 years of this happening. So very rarely does it happen.
Can you describe what you do for neck pain?
Yeah, so usually, again, we have to first assess what's the cause of that neck pain. But then our treatment is usually going to be involve uh, three or four um, 3 or 4 modalities. So 9 times out of 10, we're going to use acupuncture. After acupuncture, we apply therapeutic cups. They're suction cups that help to pull on the tissues. They relax the tissues, but they also promote local blood flow to the area. And all of the healing properties of the body are contained in the blood. By increasing blood flow, we help to heal. And then we do massage, we do body work, and we use Chinese herbal liniments or pain patches that we apply directly to the skin that reduce inflammation and control pain. And then we often do some kind of exercise on the neck, maybe a little bit of stretching, and give patients therapeutic exercises to do at home, much like a physical therapist would.
Can you repeat what you said about treating patients with high blood pressure? And if their blood pressure is under control, does that make a difference in how you would treat them?
So the only thing that we wouldn't do for patients with high blood pressure is use infrared heat on them, especially if it's uncontrolled. Um, we use a combination of acupuncture and then often herbal medicine, again, because this is more of an internal condition to control blood pressure. And we try to understand what's the cause of the blood pressure. Oftentimes, there is no known cause. It's primary hypertension, just people have this condition. Acupuncture can be effective. Herbs are also tend to be the next line of approach for us. Um, if their blood pressure is under control, um, then it's up to the patient whether or not they want it to be a focus of the treatment. If their goal is to try to get off medications, then we tend to try to work hand in hand with their physician. We never recommend to patients that they get off medications without consulting with their doctor. We're very careful and safe about that. We do not have expertise in pharmaceuticals, but we can work with patients and their doctors to help them get off of blood pressure medications or other kinds of medications.
Okay, question here. Is there any reason why you don't have more male patients?
I just think by and large, I don't know what it is about our culture or the psychology or sociology of men, but they don't seem to be as interested in caring for their health. Men typically come to us when they're in severe pain, when they can no longer kind of function. They can't get out of bed in the morning, or their knee hurts so bad they can't climb the stairs, or they can't engage in whatever activity they usually do. But otherwise, they tend to ignore, for some reason, they ignore their conditions. That's the best that I can figure. We're quite successful in treating men, but men don't seem to be quite as interested in seeking out healthcare.
Okay, when you talk about herbal medicine, what kind of herbs are we talking about?
Yeah, so we're working specifically with medicines that have been used for thousands of years in China, Taiwan, Japan, Tibet, India, mostly Asian species. In Chinese herbal medicine, we use the term herbs, but it includes plants, so stems and leaves and roots and fruits and seeds, but it also includes minerals, includes shells, and in some instances, it might include certain kinds of animal products, like certain kinds of gelatins or bones of animals, things like that. It's quite a wide variety. There's literally tens of thousands of things that the Chinese over its long history have categorized in terms of their medicinal properties. And commonly we use right now about 500 or so. I have an herbal pharmacy here. We have about 500 different substances that we use all across the board. All have been, the other thing to keep in mind too is that the FDA does actually oversee herbal medicine. They do not allow substances to be used in the United States that are deemed to be dangerous or harmful to people's health. And we also tend to work with a form of herbal medicine called granules, where the stems and twigs and roots and branches have already been boiled and they get reduced down to something resembling sort of instant coffee. It's a granule. You just add a couple of spoonfuls to hot water. And all of those are produced according to modern pharmacological standards. They have to adhere to international production standards and are quite safe.
Okay. We had a comment earlier, somebody recommending Rebecca, apparently has been going to you for years, but it raises the question, how many acupuncturists are there in the DC area?
Maybe Rebecca knows better than me, but I know.
I'm not sure exactly in the DMV, but in the state of Virginia, I think there's maybe 600, but that includes the whole state. So,
Mhm,
and also there are some MDs that are that do acupuncture as well.
mhm.
So if somebody's looking for an acupuncturist, where do they go? What, is there a website or a directory?
Actually, I can answer that too. Their NACOM, NCCAOM, is the national organization, and Damien's certified with them. I'm certified with them, and you can put in your zip code and look for an acupuncturist in your area, and they may post their website and talk about their particular areas of expertise. Damien, do you have anything to add to that?
Yeah, the only other thing I would add is that you can search for providers through your healthcare insurance, and that way you can find people who you know are already in network and will accept your healthcare. So that can also narrow down the search.
Right, right. And because I've had such fun experience with health insurance, I actually do private pay as opposed to health insurance. But I do a super bill so that the person can get reimbursed if their insurance takes acupuncture
Mhm,
out of network acupuncturist. So.
mhm.
All right, well, we're almost at 11 o'clock. So if anybody's got any last questions, speak now or forever hold your peace.
I guess it doesn't sound like there is any other questions. I don't see anything else in the chat. So, Damon, thank you so much. This was very helpful, and I did put the link from the Aging Matters program in case somebody missed something or we covered something when I interviewed you. So, but this was very, very helpful and provided a lot of good information. I think people sometimes don't think about acupuncture as an alternative. And so this was very helpful. So thank you
You're
so
very
much.
welcome. Yeah,
Really
thank you.
appreciate it.
I appreciate the time to come and talk with everybody.
Okay. So it's 11 o'clock, and we'll just remind you that next week is another coffee and conversation. And next week, our guest will be Moira Quinn Lighty. I think it's Light or Leet. I'm not exactly sure, but she's the president of M. Quinn Designs. And she's going to talk about home lighting and how that can accommodate the aging eye. So another program about our bodies and as we age in place. And I'm sure it'll be very interesting. So be sure and tune in next week, same time, 10 o'clock. And meanwhile, enjoy the warmer weather and stay warm.